Good afternoon. I'm the only one of your speakers who qualifies to be called agent. And Paulin, who persuaded me to come, gave me, when I walked in, says, "This is the sage." So I really feel old among you. Well, thank you for giving me this opportunity to highlight some issues in palliative care. I don't know why I'm here, because it is about aging in place, and hospice is not about aging in place, but dying in place. Anyway, one of the speakers said, aging in place until you die. So I'm the last speaker because this is the until you die, at the end, hospice. I want to start with this picture, taken in October 2008, when the minister, and also a quotation by the minister. For most of us in the hospice movement, this is ultimately what we work towards. Everybody should be able to die with dignity, without pain, surrounded by loved ones. Very nicely encapsulated in the words of the previous Minister for Health, Mr. Khor in 2008. This patient has since passed away, and I'm very pleased to say that it was obvious from this snapshot that he experienced a beautiful death. We see family, we see love. Patient appears fairly comfortable, and there is a good level of completion. And in this scenario, we have family members. They came to celebrate his birthday. Family members and caregivers, in this case, had a good sense of closure. What we do in palliative care and hospice is not limited to what we can do for patients, but also what we know we have to do for the loved ones they leave behind. For those who don't know much about palliative care, I've put up this slide. It's a simple table to tell you what palliative care is all about and what constitutes good end-of-life care. For many years, palliative care was at first given only to end-stage cancer patients in a lot of pain, but today it is now delivered to those with, for example, organ failure and neurological diseases. So from this slide, I won't go through all the points. I think you will have read it by then. Palliative care is ultimately about dying a good death. Now, I expected this slide to be presented by the earlier ones, but all this slide tells us, Paulin has given us the gory figures, and these are repeated. This came from the NSPC study, and they presented it as table number 2. All it tells us is that we are aging. And Kai Hong, we said that 20 years ago, and now we're scurrying, whereas had we started 20 years ago, we would be in a very much better position. Very briefly, I will take you through the history of hospice in Singapore, because I'm sure from the looks of all the young ones behind, you do not know. It was in this article in the Straits Times of July 1986, which stirred many, and I mean many, Singaporeans to write in. Their response prompted, in effect, the birth of the hospice movement in Singapore. In Singapore, the Ministry of Health and ministers gave reasons that hospice was not to be, and what they were against, why they were against hospice, is epitomized in this slide. Those here old enough to know about Sago Lane, and it's not the Sago Lane you know, where you go and buy things, where there's a beautiful temple. This is the original Sago Lane. Will recall that this was Singapore's Death Street, where destitute old folks were sent to die. I was told that when the simple beds you see in this slide were full, some were made to sleep in coffins. How did hospice start then? Here again we see the father of charities in action. After the Straits Times article, Dr. E. Peng Liang persuaded his church and the Catholic Welfare Services, which ran St. Joseph's Home, to set aside initially 4 beds to care for the dying. These were the first hospice beds in Singapore, and the carers, besides the nurse sisters of St. Joseph's Home of the Canossian Order, were volunteer doctors like Dr. Anne Merriman, who together with other doctors like Dr. Cynthia Goh, later employed 1 nurse, and beginning from Dr. Anne Merriman's home in Gilman Heights and US quarters. At that time, they did not check to see whether Anne was doing funny things in her home. But that was where hospice started, the beginnings of what was to be later HCA Hospice Care, the largest home hospice provider in Singapore. Fast forward. This picture shows the groundbreaking ceremony for the Hospice Centre, which houses Dover Park Hospice, Singapore's first purpose-built hospice, and HCA Hospice Care. We are there with the then President, Wee Kim Wee, who was a very, very good supporter of the hospice movement. Here is how we started building the hospice. Today, we have 4 inpatient hospice services. After a decade, and now I'm talking about the early 2000s, Ministry of Health told us, no, too many hospice beds, no more hospice beds. Then in 2008, we were told that more beds were urgently needed. And today we're looking at the redevelopment of Assisi Hospice to be bigger and Dover Park Hospice to be renovated to increase intake, and eventually probably the redevelopment of Dover Park Hospice. In November 2010, a survey conducted by Forbes was issued. The results was issued. This survey was commissioned by the Singapore Hospice Council to gauge the public's awareness as to hospice services, fees charged, services provided by hospices, amongst others. The objective of the research was to gauge the level of awareness as to the availability and range of hospice services, and also to ascertain the willingness of current and potential users to pay for different hospice services. Of the 1,035 respondents, 508 were current users or related to hospice services. The survey revealed a positive attitude towards using hospice services, with about 79% of the general public surveyed saying they will recommend hospice for the terminally ill. This is a jump. 20 years ago, nobody wanted to go to hospice. This is death house. But the survey gave us that positive aspect. But the negative aspects. However, the survey also showed that, 1, very few people were aware as to what services were available. Day hospice, inpatient hospice, home care. Very few people knew that there were these 3, and that hospices lent equipment such as wheelchairs, beds, oxygen concentrators to needy patients to be used in their own homes. Furthermore, we found that when the man on the street hears the word hospice, they immediately associate it with giving up hope, end of the road, and death. We know that in our society, death is still taboo. The notion of hospice care is a loss of hope. Availability of funds and donations is how we sustain our programs. Hospice care costs, in coverage, insurance, there ain't any. There's always difficulty in raising funds. In Singapore, it's very easy to raise funds for children, number one, animals, number two, right at the bottom, dying people, all right? So we're understaffed, and we have also very inadequate support at grassroots levels. Medicine is about curing. Yet in today's context of highly advanced science and technology, we still have not found cures for all diseases. For many doctors, death is an admission of failure. And it is not common for us to get referrals from GP doctors. Most of our referrals come from acute bed hospitals, NCC, NUH, Tan Tock Seng, etc. Many patients and their families choose treatment at the hospital. Families want to do what they perceive their best for their loved ones than just keeping them at home or sending them to a hospice. Home care is usually privately funded, maids, caregiver, nurses, sisters, daughters mainly, whilst hospitals are heavily subsidized. Now, this leads to a perverse outcome. It is cheaper to send loved ones to be in the hospital than treat them at home or to send them to a hospice. Okay, I'll tell you why at the end, not now, right? Many medical professionals still don't know very much about hospice. When we started 20 years ago, many didn't want to know. But thankfully now, many are coming on board. The secret is to start teaching them young, and we have. For 15 years now, the hospice community under the Singapore Hospice Council has been conducting teaching sessions to medical school students, initially here for NUS, now NUS as well as Duke NUS students. We have had notable success. And I quote one. Among the 2011 President Scholars, one has said he wants to do palliative medicine. That is really something. You make a lot of money doing other things, other areas of medicine, and no money doing palliative care. I wish to share with you the experience of one of the organizations, one I'm actively involved in, HCA Hospice Care. We decided in 2003 that we needed to do something extra rather than stay in our silo, right? We were in one building. In its initial years, HCA had worked from its headquarters in Gilman Heights and then in Gilstead Road, and then from the Hospice Center in Jalan Tan Tock Seng. In August 2004, HCA initiated its first satellite center in Jurong East under its Hospice into the Community program. And in the next few years, HCA opened up centers in the Northeast, in Hougang, Northwest, Woodlands, and East, Bedok. You see all those places in that particular map. Needless to say, with this greater reach, more patients have been helped. In 2004, we reached 2,900 patients. Now, in 2011, we now look after 3,600 patients. And there is greater community recognition of hospice work. Nurses, doctors, and social work professionals work from the centers. In many ways, our satellite centers are independent hubs of teams working in the geographic community they are located in. I got 5 minutes. Caregiver training is an important activity at the satellite centers. This is conducted at the centres and normally on a Saturday. Empowered and happy caregivers who know they can come to us when they need help are essential for good delivery of home hospice care. HCA started this as its student education program. We made 3 sets of videos with facilitated materials for primary school, secondary school, and tertiary levels. Our aim, to create awareness about elderly sick and to tell students from primary all the way to university that they can and have a role to play in caring for their beloved elderly family members. Today, we have reached more than 60,000 students from 156 schools. There's still more to go. The program has 2 components: the viewing of videos and facilitated discussions, and thereafter, we can help visit to a day hospice or a day elderly care facility. I shall not talk to you about the support funding for this program. That is yet another problem. There's a paradigm shift now in hospice palliative care. Once upon a time, the old concept, after you cannot be cured, then you fall into palliative care. Today, the concept is as your disease, we come in very early, and as your disease progresses, there's more support in palliative care. In 2010 and 2011, 2 important publications came out, both commissioned by the Leng Foundation. The first, a report by the Economist Intelligence Unit on the quality of death, where 40 countries around the world were ranked for the provision of end-of-life care. The second, where 78 doctors across the health scene of Singapore were interviewed to give their views on our state of care for the dying. At this stage, I wish to acknowledge with gratitude the Leng Foundation's support for the Singapore hospice movement and the advocacy for better care for the dying as part of its mission to advance elder care and its efforts to destigmatize death and dying by advocating dialogues, spelled D-I-E, logs, amongst our people. Some pertinent findings are here. The overall score, we score 18. The health environment, we score 30. Quite low. Availability, 16. Cost, median. Quality, good, 11th. Public awareness, median. And in the care of the dying report, this is what Singapore doctors say. Firstly, they are not clear about end of life. They see that there's an important role of families. The healthcare in Singapore is complex and does not fit needs of dying patients. And also, there is an important role for religious and personal beliefs. This then kicked off what Ministry of Health. After these 2 reports, they have to do something, right? So they set up the National Strategy of Palliative Care, whose report was published in 4th October 2010. The MOH on 5th January this year accepted the report, and in April this year set up a task force to look into the implementation of the recommendations. Suffice it to say that all the recommendations are excellent. I await with great anticipation the actual implementation, and I hope it will not take another 4 years. If you remember the first slide, Minister said 2008, right? Today, it still hasn't happened. What is needed? Health insurance must cover hospice services, like in the US, where patients do not co-pay, and co-pay has become another of our, sacred cows for inpatient or home hospice services. It is in the US, it is covered by Medicare, Medicaid, managed fund, private institutions. We need regional satellite day hospices. We need support for community outreach and education programs from the community. And we need more caregiver support and training. Paying for the end-of-life care. I repeat, health insurance must cover hospice services. It is now ridiculous. You go to NUH, you get covered by insurance. You come to Dover Park Hospice, you get no cover. This is the ridiculous scenario we have. Home hospices should continue to remain free of charge for patients. If you're not going to pay for home care, then home hospice services have to remain free, because these are the people who need us both most. And the HCA model has shown that this is a viable business option. This last slide shows what are the hospice bodies we have. And the good thing about hospice in Singapore is we have come so far because we are a united body. Thank you. And we can now talk about